How comfortable are you giving your personal and private information, your Social Security number, your tax information, your income information? How comfortable are you giving it to people who aren't qualified experts, who aren't health insurance experts, who aren't healthcare experts, people who may have had 5 hours of online training, who are supposed to act as the gateway to Obamacare? These are the people that are on the front lines of implementing healthcare.gov. These are the people you're supposed to forfeit your information to. Larry, would you be comfortable giving your personal information to these people? Most Americans probably aren't.
Yeah, heck no. Listen, Carrie, let me go to you on this because there's another nasty part of this. It has been reported that numerous navigators have told their clients, so to speak, to put up false information, particularly regarding income, so they can get more tax credits or more subsidies. So basically they're in the falsification mode, the lying mode. Now, that can't work.
Now, numerous would be inaccurate. This report came out in September, as you said, and the HHS has already fired the navigators who were accused of wrongdoing. So let's think about Medicare.
They just fired 5 of them, Carrie. 5 of them was the report. 5 of them. Now, this has got to be a bigger problem than 5.
No, so listen, Medicare is this important part of the fabric of how America takes care of our grandmas and our grandpas. We make sure that they have quality health insurance and peace of mind that they won't be bankrupt by doctors' bills. Now, how do they find out about Medicare? Through Navigators. Navigators has been around for decades. CMS runs it. It's the office at HHS that runs Medicare and Medicaid. And this is a system that's been around for a long time. If there are navigators who are accused of wrongdoing, they're fired. This is not a big problem. And just as today there's so much partisan politicizing of Obamacare and fear-mongering, there was fear-mongering about the beginning of Medicare. And millions of Americans have done very well with Medicare, and it's a very popular program.
Right. So
the same will be true about Obamacare.
Yeah,
just wait and see.
You can comment on it generically, but I think this whole business, look, Social Security numbers, birth dates, addresses, phone numbers, annual income, sensitive tax information. Carrie says that the navigators have been around for decades. Is that true? I never heard of them. This is new to me.
Yeah, Larry, that's not true at all.
Yes, it is.
That's not true at all.
Let me correct the record here. So there's something really important to understand, which is that shopping for insurance on the exchanges is a lot more complicated than Medicare. You qualify for Medicare when you're 65, and today you either enroll in Part A or Part B, or you enroll in Part C, but it's relatively simple. There's a default option. It's pretty straightforward. On the exchanges, the navigator, the so-called navigator, has to know a lot about your income in terms of the subsidy you qualify for. He has to know a lot about the different plans that are on offer, the bronze, the silver, the gold, the platinum, the different deductibles, the different situation in your life. So it's a lot more complicated, and there's a lot more personal and private information involved. And let me just cut to the chase here. The whole reason why these navigators, without any real background in insurance, are being utilized to do this is because the Obama administration is terrified that if they don't enroll enough people quickly enough, this law is vulnerable to repeal. So that's why they're being very unrigorous about the people who are the so-called navigators, because they want to make sure that as many people sign up as quickly as possible so that the political strength of this law is increased, and it doesn't matter if people's privacy or if people make mistakes or if people are signed up for the wrong plan or if it turns out they're not eligible for subsidies later and pay a fine from the IRS. Those are not the concerns of this administration.